Hello, everyone. Welcome to the podcast. I got Josh Hagel on the podcast with me. He's the vice president for Pixee Medical, and just wanted to hear about his journey and understand a little bit about the technology and how it's helping patients and surgeons achieve better outcomes. So, Josh, welcome to the podcast.
Thanks, Scott. Happy to be here.
Of course. So tell me about your journey. Where'd you go to college? How did you work your way up to Pixee Medical?
Sure. So I've had kind of a different path than most in the industry. Grew up outside of Chicago, suburb of Chicago, went to school at the University of Nebraska in Lincoln, Nebraska, so I'm a Cornhusker. Studied in my undergrad molecular biology, thinking I was going to go to medical school. My path didn't necessarily take me there. And then got my MBA also from the University of Nebraska with a specialty in international business. My path, again, was a little unique. Started in research after college. Didn't really know what I wanted to do for most of my 20s until I found out that the medical device world was actually a thing and it was a career. I had a friend that was in spine sales, and really the pieces kind of all fit together. You know, I'm competitive, former athlete, interested in science, interested in surgery. Started my career just selling something. It's something that I would tell anyone that's trying to break into the medical device world is prove that you can sell something, even if you don't really have a connection to it. I sold Payroll for 9 months, and it was the hardest thing I've ever had to do, going door to door and selling payroll services in downtown Phoenix in July in a suit. It was very difficult to get told no 1,000 times a day and then get up and put your suit on the next day and do it over and over and over until you hit your quota. I was there for a brief period of time before I got scooped up into the device world. Started with ConMed Linvatec in the sports med world, selling anchors and screws and buttons and allografts. A gentleman named Scott Green actually took a chance on me, no cred whatsoever, and he took a chance and saw something in me and was there for a couple of years. Started as his associate, and then got my own territory and kind of worked my way up. From there, got an opportunity as a regional sales manager for a startup called Ortholine, which is a little handheld navigation for knees and hips. It's a fantastic technology. It's still used. I think 5% of all knees in the U.S. are done with Ortholine. It's pretty amazing. That's where I really cut my teeth. I fell in love with the startup world. Your work has more of a macro impact on the company, and it was a great 3 or 4 years, and then was approached by DePuy and sold their Velis platform for a couple of years, and was promoted into a joint recon leadership role in the West, so managed the joint recon business in the Western U.S. for DePuy. So a big geography, lots of dollars, and just recently was approached by a startup out of Europe called Pixee Medical to be their VP of sales for the U.S. I loved DePuy, now J&J. I can't say DePuy anymore, now J&J MedTech. I loved being in that role. I loved the people. I loved the products. But this was an opportunity that was just too good to pass up. And it's taking me back to my startup world where you build something from the ground up and you grind and you wear a lot of hats. That energizes me. Yeah. So yeah, this is week 2 on the job. I was in Europe all of last week and meeting the whole company. It was fantastic. I'm super excited to be in the position I'm in. I'm hiring a bunch of people right now. I've talked to probably 100 people over the past 5 days. So yeah, that's kind of where I'm at right now.
What lights your fire about Pixee Medical, and how do you see it helping patients and your surgeon partners?
Sure. Great question. So there's a couple different ways of doing knee replacements. There's the traditional way, which is just using mechanical guides, which is still a vast majority of surgeons out there are using just standard instrumentation, which is old technology, decades old. They're not the most precise way of positioning an implant. They work, but there are still some outliers. Using a technology like Pixee, which is augmented reality, can help position those implants in a more precise, patient-specific way. The technology itself is smart glasses that the surgeon wears, and it reads QR codes on the instrumentation. So it tells the surgeon angles and depths and distances.
Wow.
So it provides actual digital feedback for the surgeon versus, again, mechanical guides, which it's kind of guesswork.
What would you say are the biggest challenges with this position? I know you've only been in it for a couple weeks, but what do you foresee being some challenges, and then what's a really rewarding aspect of this job?
Challenges are, I think, good challenges. So number one is just building something from nothing.
Yeah.
Something that has a technology that has no brand recognition in the U.S. quite yet. It's my job to change that. Something that's really rewarding, I'm able to build a team. I've always wanted to be a people leader. So the ability to hire people that I trust and can lean on and can work closely with is something that really excites me.
And then is there other technology that does this, the augmented reality and mixed reality out there? And what kind of separates Pixee Medical from those other players in the field, would you say?
Sure. Good question. So the most widely used enabling technology within orthopedics are robots.
Okay.
You've probably heard of the Mako robot.
Da Vinci as well.
Da Vinci for general surgery. And there's several iterations of robotics within the orthopedic space. This is different in a couple ways. It's a smaller footprint. So it's just a little instrument pan and a set of smart glasses that attach to the surgeon's hood. It's lightweight, low profile, cost conscious. So it's not millions of dollars to purchase the system. It's just a pay per click. So it's very friendly for for ASC settings, surgery center settings, which more and more total joints in the US are migrating to surgery centers. So I think our timing with the technology is perfect. We're also moving really fast with our development. So what the system looks like today is very different than what it's going to look like in 12 to 24 months, which is a very exciting thing to be part of.
That's amazing. And then you're a big part of the hiring process, the interview process, and you've been a part of that when you were with DePuy Synthes as well. From your experience in the past of bringing on good reps and good representation, what have you seen that has been, what are the good reps possessing as far as characteristics? What do you look for in a good rep when you bring somebody on board?
Sure, that's a great question. So I look for a couple things. For someone that's just beginning in the industry, I would recommend saying yes to everything. So if your boss tells you to get up at 3 a.m. to go reset trays, you get up at 3 a.m. to reset trays. Yeah, I mean, you could appreciate that.
Yes, I can, yes.
I literally just do everything that your boss tells you to do. Go above and beyond, always be educating yourself, because as you know, this is a very technical sell. This is not a transactional sale. So you need to be speaking at the level of the surgeon in order to be successful. So you can never stop learning. I also would recommend to be friends with everyone, even your competition, because this is a very small world and you never know who you're going to be working with in the future. Never burn a bridge. Every position that I've left, I leave on good terms. Still speak well of those companies and those technologies. I would just recommend, staying close with everyone.
And then going back to ConMed, where you got your start, how do you feel like you broke in? Did you reach out to the rep? What do you recommend that other people do that are just trying to get into this industry, that maybe have a little bit of sales experience or don't have any sales experience? How do they get their foot in the door and start off with networking to be able to get their shot?
Sure. So I'll go back to what I said. I sell something.
Yeah.
It doesn't have to be a sexy medical device. Sell dictionaries. It doesn't matter, because you may not be a good fit. It may not be your thing, and you'll quickly realize that in a lower stakes environment. But be persistent. Keep trying. There's a lot of companies out there. There's a lot of technologies out there. Never give up. I started when I was almost 30, so it's never too late.
I love it. And then for our surgeon partners that might be listening, any last words for why they should consider Pixee Medical for doing their total joint reconstruction?
Yeah, a couple of reasons. So it's a very forward-looking technology. I think augmented and mixed reality is the next wave of enabling technology within the orthopedic space. So it's going to be a fun ride to be part of. It's, cost conscious, low profile, easy to use. Learning curve is no more than 5 cases. It's a repless model. You don't need a product specialist to run a big piece of capital. It's a fun technology. It's really and it's a great company. I can tell you that being part of the Pixee brand is something I'm very proud of. And going over to Europe last week and meeting everyone, it is the sweetest group of people, and I just couldn't be more proud to be part of it.
I love it. Thanks, Josh. I really appreciate you coming on the podcast.
Thanks, Scott. I appreciate it.